Let's do some other stories away from security. The search for water by nurses in the Wa West district has compelled some of them to travel to far communities, some close to neighboring Burkina Faso. The Wa West District Health Directorate is appealing to government to provide potable water sources for use by hospitals. Rafiq Salam reports from Wichao.
Health sector review meetings held by the various metropolitan, municipal and district health directorates in the country are aimed at taking stock of the achievements and challenges. It is also an accountability mechanism where the performance indicators of the directorate are presented and discussed with their key stakeholders with a view to finding ways to enhance service delivery. The Wa West District is therefore no exception, as major stakeholders in the health sector, including heads of decentralized institutions, civil society organizations, development partners, and traditional rulers, were brought together to deliberate on issues on the performance indicators of the district. Wa West District Director of Health Services, Clifford Venkumane, set the tone of the conference by laying bare the successes chalked under the year in review.
We increased our institutional or skill deliveries from 54.4% to a 63.6% with a set target of 60. This was achieved by training and deploying midwives to facilities including chief zones that contributed tremendously to the skill delivery average.
Clifford Venkumane, however, lamented on how staff risk their lives to armed robbers due to lack of accommodation.
There are instances where staff cannot get a room to rent in the community where they have been posted, and that compels these staff to commute daily for work, impacting on their health, exposing them to robbery, and also affecting their finances. Our facility water coverage is a major concern.
The Wa West District Director of Health Services also expressed worry over the lack of potable water in some of their facilities, making some of the staff to use productive working hours, carrying gallons looking for water.
A lot of facilities are there without access to potable water, not even from the community. We have health facilities that do not have single borehole, and even the community that they are cited, there is no borehole.
Reporting for Joy News, Rafiq Salam, Wichao.
Let's speak to the MP for the area, Peter Tobu. He joins us on the line. Thank you very much, sir, for your time here on Joy News Prime. This is an area that already has challenges with the numbers when it comes to health personnel. This definitely is another layer of disincentive for health officers. You must be worried. Well, we seem to have lost the MP on the line, but let's speak to the Ghana Registered Nurses Association. We're joined by its president, Perpetua Lofori Ampofo. Thank you very much, madam, for your time here on Joy News Prime. First of all, what's your reaction to this story from Wa West, where some of your members are compelled by the circumstance to travel long distances in search of water?
Good evening to your listeners. It's indeed a worrying situation to have our comrades, our colleagues walk such distance to get water to do what they need to do. It's unfortunate that these things are happening amidst salaries that are inadequate and all of that. During our last negotiation on our conditions of service, we drummed home the need to have a rural incentive package for our comrades who work in these rural areas to serve as motivation for them. It's sometimes very difficult for our colleagues to accept posting to such deprived areas. And once they do, and they are ready to give up their best in terms of their profession, I think there shouldn't be this added difficulties of water or anything else that will make their work more difficult.
Joined by the communications manager at the Ghana Water Company, Stanley Mate. Mr. Mate, the Jambusu Wa Water Project was expected to extend water supply to some of these areas. But we are learning that this area, specifically, or these areas within the district, are not exactly within the jurisdiction of your company. How so?
Yes, that is true. So it's only an assumption that is supposed to serve all areas within the region. With Ghana, with the water sector, okay, we are divided into rural and then urban water. The GWCL serves only urban areas. Okay, occasionally we give water to some rural areas by virtue of their location and by their population as one of the factors. Okay, so looking at the areas around Jambuzi, or the areas along the Jambuzi route, we have had challenges with them, and we are trying to manage that one. We are trying to solve this problem together with community water and ensure that they have water. But for now, it is not within our domain to be supplying water to those areas.
So
and,
when
I said, we are having that discussion with community water, and then we'll know how to go about it.
So can you let us into some details with about this conversation with community water? When you say you are having a conversation with them, are you looking at extending water supply to cover these areas as well?
Okay, so for now, there are some areas where we can sell bulk water to community water, and then they can manage within the communities. So we are looking at all those areas, and it's not just the Upper West region, but the entire country. So there are some areas within the country where we should be able to supply them water. But because it is not within our jurisdiction, we may have to have that discussion with the community water, and then they buy bulk water from us, and then they supply to these communities, and then they know how to collect their revenue and all that. So that discussion is ongoing. And like I'm saying, it is not just about Upper West, but the entire country.
Mr. Martin, I'm grateful that you could join us. That's Stanley Martin. He speaks for the Ghana Water Company. Let's stay on healthcare, and we'll return to the Nurses Association shortly, because the acting director of the Metropolitan Director of Health at the Tamale Metropolis has raised concerns over absenteeism among nurses in all 52 health facilities in the metropolis. He said only 1/3 of the staff go to work regularly. According to him, this is affecting service delivery.
Speaking on a panel discussion at the 2021 Annual Performance Review meeting of the Tamale Metro Health Directorate on the theme Improving the Quality of Routine Service in the midst of COVID-19 pandemic, the role of effective human resource management in the Tamale Metropolis, Dr. Bewu cited a health facility only 18 out of the 60 health workers attend work regularly.
Generally, only about a third of the people who are happy come to work regularly. In one of our healthcare centers, we had about 60 staff on duty, on roll. If you do an analysis of the attendance, it's only about 18 people that come to work regularly, which means the rest, 32, virtually don't show up at work, but they get paid every month. The situation is very similar across all the healthcare centers. It is time, therefore, for all of us to put our heads together to address these challenges so that we can all be assured that should any of us develop an emergency here in this room and rush to any of our healthcare facilities, our facilities will not be the reasons why we die prematurely.
Madam Perpetual Ofori-Ampofo is still with us on the line. She's the president of the Ghana Registered Nurses Association. Madam, your reaction to this? Your members are not going to work, and already we know the situation in many of our facilities where the numbers are extremely low. What's your reaction to this?
Thank you, Ernest, but let me put in a little correction. The name of the association is Ghana Registered Nurses and Midwives Association.
Very well taken. Thank you so much.
Absenteeism at the workplace, for me, is a lapse in the administrative system. As a trade union, we do not condone any such unprofessionalism on the part of our members. But the news item, if I heard right, was referring to health workers, especially at the health centers. It did not state that it was mainly nurses and midwives. But to say the least, it's important that the management or the district health directors or whoever are involved as management should look at the issue critically, because the Ghana Health Service has its rules and regulations, and it has policies that guides employees in terms of what they need to do and what they don't have to do. And there are policy guidelines for disciplinary measures that can be made out to people who flout these regulations. And therefore, if they are having issues of absenteeism, I see it as a lapse in the administrative system, and that they should sit up and do the right thing. They shouldn't be withheld by issues of maybe it was this somebody who fronted this person to be posted here or there, and therefore it is difficult for me to talk about this. They're bold enough to do what they need to do. We have ethical questions, whether you're a doctor, whether you're a nurse, whether you're a pharmacist or any other professional. And as part of our ethics and standards, you can't just absent yourself from work. The guidelines, if for any reason you cannot go to work, the systems are there. You must use those systems to get the right permission to absent yourself. If it is sick leave that you need a few days to go off to do one thing or the other, the systems are there. You just use the right channels and then you get the permission. But you just don't get up when you are on a duty roster to be on duty to take care of your patients and clients. You just wake up and you decide not to go to work. That's one, it's not right. I cannot endorse it.
Madam, I'm grateful for your time. That's the president of the Association of Registered Nurses and Midwives, Madam Perpetual of AMPO, for joining us there. Let's speak to the MP for Tobu, Peter, the MP for Wa West, Peter Tobu, who joins us on our earlier story about the lack of water or potable water for healthcare delivery in the Wa West district. Thank you very much, sir, for joining us. Your reaction to this story?
Thank you very much. Let me say good evening to your cherished listeners and viewers. Wa West district was created in 2004. And lucky enough, it has the Jamboso water project that is feeding the regional capital, Wa. Unfortunately, many people in the Wa West district do not have access to potable water, and very particularly so with the CHIPS compounds or the health facilities. Wa West has about 230 communities, and many of them are yet to see even a borehole for the first time in their lives. Myself, the district chief executive, and the director of health of the Wa West district are putting ourselves together to see what we can do to help. Government must come in. As MP, I am doing the best that I can. As I'm talking to you, I am sending a few balls home to see what I can do to help some of the CHIPS compounds that are really in dire need of water. The problem about water connected with communication challenges is really frustrating health workers in the district. That you go to a village, one, you don't even have accommodation that you can rent. Number two, the network is not there for you to use your phone. And number three, there is no potable water. So whatever it is, the people are so challenged. And that is why sometimes we pray that if you are people from that district who are nurses or who are teachers and they want to go back there to support their own people, we pray that authorities will always send such people back. That is not to say that there's no need for us to provide these facilities. As long as we are available and we can support, we are continuing doing our best. And I'm happy that this story is broken, and everybody listening who can support in any way. We do know that it doesn't matter who you are as an MP. Your 4 years common fund cannot provide enough water even for 230 communities in Wa West. But I will do my best.
Thank you very much, sir. That's the Member of Parliament for Wa West, Peter Tobu, speaking to us there on that story from the district where nurses have to walk long distances in search of potable water for healthcare delivery. This is Johnny's Prime.